Welcome back, everyone. Einstein's Eyes YouTube channel. I'm Carl Rosen. This is my partner, Jon Ditkoff. We trained at Albert Einstein Montefiore Medical Center in New York. We're ophthalmologists. I'm fellowship trained in oculoplastics and neuro-ophthalmology in Pittsburgh. Jon trained in Albany, doing cornea and anterior segment. Today we have a real treat.
Now, don't forget to add, Carl's in Alaska and I'm in New Jersey.
Right.
And you can continue now, Carl.
Yeah, no. I tend to forget that. Thanks, Jon, for bringing that up. But yeah, in Alaska, it's really anyway, it's a treat having Raj here. And Raj is our second president and CEO, or is it are you CEO, Raj?
President of Vital Tears.
President of Vital Tears. And we're going to talk about autologous serum. We're not vampires, just to get clear the air, but Raj is going to demystify autologous serum and explain who should use it, the good, the bad, and that type of thing. So we're looking forward to that. And then we'll end the discussion with Jon's experience and my experience. And Raj, take it away.
Sounds great. Thanks for having me today. Pleasure to be here. Again, my name is Rajan Shukla, president of Vital Tears. And we started Vital Tears in 2015 as a joint venture between Stevens Instruments, an ophthalmic device company, and Saving Sight Eye Bank, which is an eye bank based out of Kansas City. We did this to fill a significant gap in the treatment armamentarium of providers for ocular surface disease. And we got into this by reviewing the preferred practice pattern for dry eye disease at the time. And what we really noticed there was that there were no non-surgical, non-systemic treatments for severe dry eye disease other than serum tears. And then we spent some time with physicians asking them about serum tears, and they all said the same things, and that were that serum tears worked, but they are extremely inconvenient for physicians and patients, or that they're just simply unavailable in their market. In the early days of serum tears, we had physicians making them in their own office, or they would collaborate with a local compounding pharmacy in order to provide them. Very non-standardized, burdensome on both the patients and the physicians. We had patients that would drive 3 to 4 hours to get serum tears. They're doing that 6 times a year. And then based on this, we saw an opportunity to start a company to provide universal access to serum tears for every patient across the United States. And so with serum tears, the proposed mechanism of action is that when you compare the composition of natural tears and blood serum, you see that serum contains many of these same growth factors and cytokines. And those bioactive factors are essential for epithelial repair as well as maintenance of a healthy ocular surface. And as the cornea is avascular, you're getting all of the nutrients that most tissues in your body get, either on the back side of the cornea, the endoside, from aqueous humor, or from the aqueous tear flow. And so it's something that patients really connected with when we tell them that your body filters your blood serum through your lacrimal gland to make the water part of your tears. And so unlike just the simple rewetting drops that are just giving you mechanical lubrication, what we're doing is providing that biological side of the tear as well, and really building just a natural tear from them from their own blood serum. And so from a who benefits standpoint, we've done a good bit of study on this across all of our providers. We've got about 2,000 providers in the United States, and they've really said that they use serum tears for patients after they've tried OTC drops, punctal plugs, and an RX medication. And there's a lot of patients that fall into that bucket that have residual symptoms that aren't adequately treated with those other medicines. And serum tears take it to that next level and provide all of the growth factors and cytokines that they need to be able to maintain a healthy ocular surface. One of the things that we looked at as well were if there were any patients that immediately, and I'll ask both of you about this later too, if you guys have kind of similar opinions, were there any patients that you jumped straight to serum tears for? And the most common responses we got were from patients with the autoimmune related diseases, graft versus host, Sjogren's, because even if you're seeing a mild, moderate patient with graft versus host disease or Sjogren's, and they've got some symptoms, the direction that they're headed from clinical experience and say, yep, I see what you look like today. But 6 months, a year from now, we know you could really progress to have pretty severe disease. So instead of trying to treat them at that time and bring them back to a healthy ocular surface, a lot of our providers are putting those folks right away in order to maintain a healthy ocular surface from the get-go. The other patients that come in and go straight to serum are patients with neuropathic pain. Dr. Pedram Hamra sees a big bulk of these patients out of NEEC and Tufts. And his protocol is the basis of that is serum tears 8 times a day. And one of the things that are present in serum tears, in addition to epidermal growth factor, IGF, some of the other growth factors to maintain the epithelium, we also have nerve growth factor to help reinnervate cornea for those neuropathic pain patients. And so that's been extremely well received. And that's really what we've seen as that kind of dominant protocol for managing those types of patients. As far as side effects, this is one of the really great things about serum tears. There's nothing in it other than balanced salt solution, which is used in most ophthalmic procedures, very well tolerated for years, as well as your own blood serum. So non-allergenic, no preservatives. We see very few reactions from serum tears. When we got into this, the major concern was going to be around infections and making sure, since it is a non-preserved biological product, how do you keep patients safe when they're using this? And so we have a validated protocol that starts out pathogen free, and then they store it in the freezer for 6 months. And then they use a bottle that is stored in the fridge for up to 7 days. And we haven't had any reports of infection. We had one suspected. We recalled a bottle, and they cultured and didn't have any growth. And so that's something that we just really haven't seen. And in fact, the other minor side effects you see occasionally would be, let's say, burning, a little bit of irritation, but this is a progressive disease. At that point, we would say, all right, discontinue serum tears for 2 weeks, see how you feel. Oftentimes they're worse, and just kind of indicating disease progression. And at that point, you could also say, let's do 100% serum. Maybe there's occasionally a patient will have a sensitivity to BSS. So you could do 100% serum. It's just your own blood serum. There's nothing else in it. And that usually resolves most of the issues.
Yeah, no, that's great. That's great, Raj. Yeah, well done. So Jon, what's your experience with autologous serum or serum tears?
Well, I think as Roz has pointed out, there are definitely certain populations of patients where I really think about this. The number one would be the people that are failing other therapy, or they're just not adequately controlled. I do a lot of plugs. I do amniotic membrane. We do have some scleral lens patients. So in those patients, I mean, when they're not doing well, or as an addition, we like the idea of autologous serum drops. I'm glad you brought up the neurotrophic patients, because the neurotrophic keratitis patients can be very difficult. And I do think earlier is better. My experience on the whole, there is the hassle factor, there's the insurance issues. And I think that's one of the drawbacks sometimes, in terms of just going that direction, as opposed to just, hey, go buy these drops. But I also would point out, I've had really good results in some patients. I have certain dry eye patients that will say to me, and it's really strange, I can't use any artificial tears. And I tell them, go buy some preservative-free, try Celluvisc. And they come back and like, whatever I use, I don't like. And those patients, some have done really well with autologous serum. So that's been my experience. I think on the whole, it's great to have that as an added weapon in these difficult patients.
Yeah, that's a great job. So in my practice as an oculoplastic specialist in Alaska, I'm the only oculoplastic ASOPers specialist in Alaska. I see patients who've already tried things. They get referred to me. So the tears, preservative-free, the gels, side Restasis, they're not working. They either need a lid closure technique like a tarsorrhaphy or a semi-permanent closure, or we go to a scleral lens, and I really do like this as part of the tool belt, is the serum tears. I've had really good experience with patients with a keratitis where the cornea is exposed, they have a poor blink, and this really works well as an adjunct. And I wouldn't say it's a last ditch effort, but certainly it absolutely is a great tool in the tool belt to help make these folks feel better and to function better and get better clarity so that their surface is clear and they see better.
And Raj, I appreciate the fact you brought up that some people really, and some doctors out there are using it earlier on, because that's something I really haven't been doing, but I will start considering.
Yeah,
absolutely.
Yeah. I mean, there is a little bit of a hassle factor. I will admit, in Alaska, we've experienced that. we do need a peer-reviewed, randomized controlled trial. And Raj, we spoke about this before going on record, that, Vital Tears is thinking about that. That would be a great addition to the discussion and to the argument for why we should use it and use it earlier possibly, or add it to the mainstream of therapies.
I have an important question for Carl, though. What's easier, getting a good slice of pizza in Anchorage or
Or Vital Tears. Right. John, that's a good question. I can get you some whale meat though, or some seal.
Oh, Vital Tears. We do offer mobile phlebotomy even in Alaska for those patients, and so I think it's easier to get a mobile draw at your house for Vital Tears than it is to get good delivery pizza. That's where I put my vote.
But you got to deliver them. We got to get Balto to go to Nome.
Exactly.
But no, listen, great, Raj. Thank you so much. Anything else you'd like to state?
No, but if anybody's interested, you can go to vitaltears.org. You can sign up to become a provider in about 15 minutes. And then if you have any clinical questions, feel free to reach out to us. We're here anytime.
Beautiful. Thank you. Jon, thank you. Raj, thank you. Another YouTube Einstein Eyes discussion. This one on autologous serum, Vital Tears with Raj Shukla. We'll see you in the next one, and like and subscribe. So long, guys.
Great. Thanks for having me.
All right, guys. Enjoy the day.